In the United States, the U.S. FDA has approved 3 medications for out-of-hospital use for the treatment of acute repetitive seizures or seizure clusters. These include Diastat, which is a diazepam rectal gel, Nasalam, which is a midazolam nasal spray, and Valtoco, which is a diazepam nasal spray. These 2 nasal sprays have been recently approved. Other medications that are commonly prescribed and used for out-of-hospital rescue treatment but have not yet been approved by the FDA include things like oral lorazepam or diazepam or clonazepam.
In young children, one of the most commonly used rescue medication is rectal diazepam.
This is an FDA-approved therapy, and it can be given by anyone. It doesn't need to be given by a medical professional, and it can be given in the person's home or in any outside hospital locations. It's a medication that is given rectally, and it's a pre-dosed syringe. The syringe is put into the rectum, and the dose is administered. Because it's given rectally, it is a medication that can be a bit socially embarrassing to give. And so we typically use it for very young children, or it can be used in the privacy of the person's home. 2 new therapies that have been recently approved by the FDA are given nasally. And so these are therapies that are actually very easy to give if somebody is in a public setting. The 2 therapies are nasal midazolam, or an agent called Nasalam. And this has been approved for persons 12 years and older. And the second type of therapy is nasal diazepam, also called Valtoco, and that is approved for persons 6 years and older. These come in pre-measured doses. It's very, very easy to give them. You simply put the device into the nostril and squeeze, and the medication is given into the nostril. These medications can come as orally disintegrating wafers, or wafers that disintegrate really quickly when they're put into the mouth. And an example of that would be clonazepam wafers. There are also liquids that can be given into the buccal cavity or into the cheek, and that would be either lorazepam or diazepam. And then there are tablets that can be given under the tongue.